Women's Health Disparities, Osteoporosis in Postmenopausal Women by Meredith Lewis. What is osteoporosis? Osteoporosis is a bone disease that occurs in patients with low bone density. It leads to an increased risk for fracture, and the major threat of this disease is that it can be clinically silent until a fracture actually occurs. Osteoporosis occurs in postmenopausal women as bone mass declines. Bone mass peaks for women in their mid-20s for the spine and hip bones, while others reach peak by the age of 40. By the time women reach the age of 70, bone mass has decreased by 30 to 40%. Osteoporosis is most common in which of the following ethnic group or groups? African American women, Caucasian women, or Asian women? Race and ethnicity play a major role in the development of osteoporosis. Caucasian and Asian women have a higher incidence of this disease, accounting for 89% of all cases, creating a major health disparity among these individuals. 1 in 2 women over the age of 50 will have a fracture after a fall as the result of having osteoporosis. Bone mass is decreased 30 to 40% by the time a woman reaches the age of 70. Recommendations suggest that women 65 years of age and older should have a bone mineral density test to assess the risk. A few common causes of osteoporosis seen in postmenopausal women includes an estrogen deficiency, a mineral deficiency, hyperthyroidism, smoking, excessive alcohol intake, and inactivity. This age group of women should be instructed to perform weight-bearing exercises to help with balance. The United States Preventive Services Task Force recommends screening women over the age of 65 by bone mineral density testing for osteoporosis. It's also recommended that women who are under the age of 65 and have increased risk for developing osteoporosis receive the same screening. How are women screened for osteoporosis? This is done so by bone mineral density testing that's measured by dual X-ray absorptiometry, or commonly known as a DEXA scan. This scan can tell the grams of mineral in the bone per squared centimeter. Measurements of the hip and spine are also obtained to diagnose or predict a patient's risk for developing osteoporosis. The World Health Organization predicts osteoporosis to be present when bone mineral density is 2.5 or more below the average value of a young healthy woman, and this is called a T-score. So what exactly does your T-score mean? T-scores are measured in standard deviations, which is a statistical measure that reflects the difference between your bone density and the average bone density for healthy young adults of your sex. A few takeaway points. Osteoporosis can be treated and prevented before an injury occurs. Healthcare providers are responsible for screening these postmenopausal women and those at risk. The key to facing many of the challenges associated with osteoporosis is early detection and using evidence-based guidelines for screening.